So good afternoon, everyone, and welcome to the Q4 Hunger Elimination Task Force meeting. As Nessa said, I'm Randy Belhumer. I'm a program administrator at the Department of Health in the Division of Community Health and Equity, and I support the food systems work, physical activity and nutrition related work on behalf of RIDO as well. And so as Nessa said, you can all introduce yourselves by sharing your name and affiliation in the chat, and also what you've enjoyed most about the fall season so far. And as Nessa said, the meeting is going to be recorded, so hopefully that's okay. We like to do that so we can share this meeting afterwards with those who could not be with us. And so Caitlin's with us today, but I'm going to help to facilitate while she gets her voice back. And so letting you know, reminding folks that the Hunger Elimination Task Force was created in 2017 by the Interagency Food and Nutrition Policy Advisory Council, also known as IFMPAC, and also by the Director of Food Strategy as a component of the state's food strategy of ensuring food security for all Rhode Islanders. And the goal of the task force has remained steadfast in this focus area of reducing hunger and increasing access to healthy, culturally appropriate food for all Rhode Islanders. IFMPAC is extremely appreciative of the Rhode Island Food Policy Council for their work in facilitating this task force, at least since the onset of the pandemic. And so a quick review of the agenda. We're going to hear some key announcements that impact the work of the task force, and then receive an update on the state of food security in Rhode Island from several partners who operate food access programs statewide. And we're going to then move into breakout rooms for discussions to talk about the priorities in our work for 2023. 2022 has brought many challenges as the pandemic, inflation, gas prices, and many other things continue to negatively impact Rhode Islanders and the organizations that support them. However, there are many reasons for us to continue to be optimistic, and several key opportunities are available that would allow us to continue to build upon the great work of the task force. And our state's Director of Food Strategy, Julie Stelmacic, is now going to discuss some of these great opportunities. Julie?
Thanks, Randy. Hi, everyone. Good afternoon. I'm always inspired by the number of partners that show up to these calls voluntarily every quarter. And so I just want to say thank you again for continuing to participate in the task force. It would not be successful without your participation. So I just want to share briefly some kind of high-level takeaways that I think that the task force should be considering, that's been launched as part of the Biden and Harris administration's recent national strategy on hunger, nutrition, and health. They held their first conference in 50 years at a federal level a few weeks ago. Hopefully some of you attended or are able to look back at YouTube. So in conjunction with the conference, they launched this strategy. It's only 40 pages, and I recommend you read it. And I think there's a lot of opportunities for us to look at some of the cross-alignment with our own state food strategy and across our organizations, as well as the task force, be prepared for some of the funding and programs that might be coming out of this new strategy, because I think there's a lot of opportunities that we could take advantage of. So if you move to the next slide, we have a few examples here of some of the crossovers that I'd like us to consider and perhaps even bring up for discussion in the breakout rooms. So some of these, you can read. I'll just highlight a few of them. There's a national discussion around free universal school meals, free healthy school meals. There's discussion around leveraging HUD, the housing department at the federal level, and other community programs to cross-promote programs which better connect people to local and nutritious foods. Of course, expanding all of the really essential federal nutrition assistance programs, and addressing access. I think if you move forward, you'll see a few others here that I just wanted to highlight. Modernizing federal programs, eligibility, applications, and whatnot, something that we are talking about as we think about the update to our state food plan, a 2.0 strategy, is also looking at an emergency food plan, including natural disasters for both short and long-term food security, looking at intersections with hunger relief and economic development. They talked in the strategy about a whole of government approach. I think that's something that we continue to try to center as we think about some of our own strategies. Farm to institution is another one, transportation, and so on. So there's just a few of them here that we wanted to highlight. I highly recommend you just look through the report. And I'd like us to just continue to be aware of some of the federal programming and funding specifically that might be coming through. Of course, there's a whole legislative process for that, but might be coming through that we should continue to be responsive of. So I will leave it at that. And I would love to discuss with any of you some of the ideas that have come out of this national strategy. Next, I would like to introduce Ines Rashen from the Rhode Island Foundation, who is going to tell us about a really exciting opportunity for this network, which is a newly launched grant program that's been funded by ARP, the American Rescue Plan, for nonprofit organizations in Rhode Island who provide critical food security services. Ines, I'll turn it over to you.
Hi, thank you. Thank you for having me here. And I'm also very happy to join this group. It's very exciting work. I'll just tell you a little bit briefly about me. I am a senior program officer at the Rhode Island Foundation, focusing mostly on basic needs and children and families. We do have other programs. If we have time, 1 to 5 minutes, I will bring them up. But to focus on the ARPA grant, it's really funding to address food and housing insecurity, and also support behavioral health. So this funding is funding to support agencies that had to step up during the pandemic and had either increased cost due to increased demand for services and/or had decreased income. But basically, it's not necessarily for you to take on a project or to support a specific program. This is general operating expense funds that are to support agencies that really did step up during the pandemic and are still impacted by it. So we said it was food, housing, and behavioral health. There's 20 million available. We anticipate that the grants will range between 50 and 150,000. Agencies can certainly request less, but that's kind of like we're expecting. And we think that if agencies stick to those ranges, we'll make about 200 grants available. The application is currently open. It's easy to find if you just go on our website, rifoundation.org. It's on the main page, and the link, you'll find it immediately there. The deadline for the application is set for February 15th, but it really will stay open until there are funds available. So it is important to apply as soon as possible in order to be a recipient of those funds. If the deadline stays open until February 15th, then we anticipate that the latest we will notify will be in March 2023. We anticipate that it'll take between 4 to 6 weeks before we respond, and we are looking to review them in batches and notify in batches also. And I'm going quickly, so sorry. This will be for Rhode Island-based agencies, the funding. And if there's an agency or a program that needs to use a fiscal agent, the fiscal agent must be a Rhode Island-based agency also. We will be looking also at agencies that are in qualified census tracts. So it is important for us to keep track of that for the state. So we ask that for any agencies that submit an application, not to use a PO box address, to use your physical address. Previous funding from the foundation does not impact your receipt of funds, so you can apply to any other program. It doesn't. We're not going to look at that. We anticipate the grants to be for a 1-year period, but we will be able to extend the deadline if agencies need more than a year to use the funds. And there is an ineligible use of funds, and that you'll see on the website, but it's like you can't pay, sorry, that you'll find on the website. I don't have the list for that. And yeah, so I think that's it. Is that good, Kaylin? Yeah, okay.
Yes, thank you so much, Ines.
And I'm happy to answer any questions via chat if anybody has any.
And just so everybody knows, we put a link, Ali put a link to the website in the chat too. Thank you, Ines.
Thank you, Ines. Next,
Very welcome.
Nessa Richmond, our network director from the Food Policy Council, will share an exciting new tool that will be available soon to inform and help us communicate about our work on food access in Rhode Island. Nessa?
Thank you, Randy. So this is a preview of what will be our interactive Rhode Island Food Systems Metrics Dashboard. It is going to cover all different areas related to our food system, but today we're going to be focusing on food security and access. Our hope is that, this site will be a place where you can go to find numbers that can help you understand Rhode Island's food system and use them to meet your own mission and objectives. The data in the dashboard aligns with an approach that really looks at people, places, and the planet. So it's going to be a snapshot regularly updated that shows the state of the food system. It can be considered to be in beta form. If there are indicators that you think should be on this dashboard and they're not there yet, we are happy to get information from you about what you think should be there and to build it out over time. You can go to the next slide. So we really want this to be a useful tool for you. And so we have only data from trusted sources. Everything is clearly cited. The charts are actually interactive, so you can scroll over and see information, for instance, for your county or for a particular year. It's going to be updated regularly, and we have brief descriptions of the data, and we have also included equity metrics and demographic indicators wherever they are available in those population level data sources. You can go to the next slide. I'm just going to give you a few sample grabs of what the data is going to look like related to food security. So this chart actually provides you with information on the average number or the number of people in the state who are food insecure or very food insecure for each of the last 20 years. We always go back 20 years in these charts whenever that much data is available. So this is one example. You can see the description to the right of the chart, and you can also see the data source citation. When there's a particular issue that we want to call out, we will highlight that with these gray bars. We can see the gray bars on the left side show you where the Great Recession happened. And then the bar all the way to the right, the gray bar, shows you, of course, the COVID pandemic. You can go to the next slide. So here we've used data from the Rhode Island Community Food Bank to show some food insecurity statistics for by race and ethnicity for 2021. This is just showing you that we are trying to integrate demographic information into the dashboard whenever possible. If you go to the next slide, you can see some information about SNAP participation over time. Again, the recession is called out. You can see here, for example, a story that tells a story that the recession caused a lot of people to become SNAP beneficiaries, and that number never really came back down to where it was before that recession. We also have this information available here stacked by county. So in the interactive version of this snap chart, you will be able to click on your county and hover over and see the exact number and percent of people per county per year. You can go ahead. Thank you. Just a couple more by way of example. This shows SNAP participation by race and ethnicity and by county. So again, we really want you to be able to go in and dig in to the information, easily pull out what might be helpful for you. And on the next slide, which is a little bit messy, like I said, we're still tweaking this. It's not quite live yet. But here you can see again from the Rhode Island Community Food Bank the number of residents who were served per month shown on this annual basis, again with the COVID pandemic highlighted in gray. So finally, I just want to talk a little bit about how we want you to be able to use this data to reach your goals. And these are just some examples to consider. So setting strategic goals for your organization, setting measurable objectives for your projects and programs, certainly pulling them to make your points in grant proposals, using them to make points during public speaking opportunities, including supporting any testimony that you want to give at the State House. So we expect that the dashboard will go live in approximately 2 weeks. Certainly by the end of the month, we're hoping it will be available, and we will be having a webinar specifically for folks who want to learn more about how to use this data and maybe have specific questions about how to use that, because we really, again, want it to be a tool for everybody to use to reach your goals and your mission. And I'll pass it back over to you, Randy.
Thank you, Nessa. And I just wanted to point out in the chat, Ines, there is one question there, perhaps you already saw it and responded, from Amanda Cantrell. Are there any federal reporting requirements for agencies receiving the funds?
There will be some requirement, but the Rhode Island Foundation will take up most of it, but we will ask for some evaluation, but not the federal type. So we will take it on, we will collect the data from you, and we will report collectively.
Thank you. So we're going to move on in the agenda. Keep your questions coming in the chat. And thanks, Nessa, for sharing the Food Policy Council's data dashboard. Really excited to see how the task force members and even us in state government can use this in our work. We're going to move on to several key updates from members of the task force who operate statewide food access programs to get an overview of the current landscape of food security in Rhode Island and how they are adjusting their programs to the changing needs of their clients. So we'll start with Andrew.
Thanks, Randy. You know, Randy, you said in your introduction that low-income families are being affected by inflation, and we're certainly seeing that. The irony is that unemployment is low, but people are working, but low-income families are seeing higher rent, higher utilities, and higher food prices, which is leading more people to turn for food assistance. So we have a chart. The bottom blue line is 2019, the number of people served at food pantries in Rhode Island that are members of the food bank. And the top orange line is this year. So we saw a dramatic increase beginning in March with an increase in the number of people coming to food pantries, going from pre-COVID about 50,000 people each month to now about 60,000 people each month. So 10,000 more people. And we are responding by distributing more food through our network of 140 member agencies. We've gone from pre-COVID distributing 12 million pounds of food a year to now 15 million pounds of food each year. But what's really important to keep in mind as you see this chart is that winter is coming. People are going to be facing very high heating oil bills this winter, which will put another strain on families. And in addition, some really important programs that were initiated in response to the pandemic will be ending. And Bethany can talk about this in a little bit, but SNAP recipients have been receiving extra emergency SNAP benefits. And when the public health emergency ends, those benefits will end. So that's very concerning given that we're seeing historically high food prices and people clearly struggling with being able to afford the food they need for their families.
Thanks, Andrew. We're going to hear from Jessica from RIDE next to talk a little bit about her work with the child nutrition programs. Jessica?
Thanks, Randy. All right, good afternoon, everyone. For anyone who doesn't know me, I'm Jessica Petroli. I'm the coordinator for the federally funded child nutrition programs that are administered out of the Department of Education, which include the National School Lunch Program, the School Breakfast Program, the Child and Adult Care Food Program, and the Summer Food Service Program, as well as a few supporting programs and grants that fall under those three main umbrellas. For those who do know me, I think you know that I could talk about these programs endlessly, and I'm going to try to contain myself today, but I did want to take one brief moment to just take a step back and remind everybody of the benefits of these programs as we kind of think about the context of where they stand today. So the federally funded child nutrition programs have been highly researched. They generally show positive correlations in a variety of areas. Benefits include improved food security, as well as increased likelihood that participants will consume fruits and veggies at breakfast and lunch. And in addition to reducing food insecurity and supporting good nutrition, the school meals programs have been shown to improve health outcomes and boost learning. Of particular note, school breakfast participants are shown to have improved attendance, behavior, performance, and decreased tardiness. And schools participating in CEP, which allows meals to be served universally free to all students within the community, have shown a reduction in suspension rates among elementary school students. And in counties with high rates of food insecurity, the reduction in suspension has been as high as 25%. So it's all just to say school meals are important and they can have a significant impact on the health and well-being of the children and youth in our state. So kind of with that context in mind, I wanted to take a minute to look at the role of these programs over the course of the pandemic and how their importance has been even further highlighted. As most of you probably know, when the pandemic began in March of 2020, the federally funded child nutrition programs experienced immediate and significant changes. From March of 2020 through June of 2022, meals were available at no cost to all students with no paperwork required. At the beginning of the pandemic, meals were served primarily in grab-and-go bags or boxes for families to take home and consume at a later time in conjunction with distance learning. But during the 21-22 school year, we saw most students return to in-person learning, and this gave us the first opportunity to see what a school meals program offering free meals to all as part of the regular school day might look like. Unfortunately, unlike many of our neighboring states, Rhode Island was not able to pass local legislation that allowed for the continuation of healthy meals at no cost to families into the 22-23 school year. So this year, families are required to either return a meal benefit application and qualify for free meals or to put money on account in order to receive meals at school. So it's too early to make any sweeping data comparisons, but of the 14 public school districts and state schools reporting meals for September 2022, as of the time that I put this presentation together, we can already see some significant impacts. So just from this small sample size, the return to a pricing program has seen a decrease in over 1,600 lunches per day and 2,700 breakfasts per day in September 2022, as compared to the same time period for last year. For some communities included in these numbers, That change in breakfast participation represents a change from anywhere in the neighborhood of 30 breakfasts per day down to fewer than 2 breakfasts, or in some cases even 0 per day. So we've seen from the pandemic that the need is there, and with the change in programming, it's no longer being met or accessed. The declining meal counts that we're seeing with the return to the pre-pandemic operations are likely the result of multiple factors. One significant change this year is that many programs reverted to a more traditional meal service models, so service in the cafeteria, as opposed to some of those alternative service models like grab and go or breakfast in the classroom, which were widely used throughout the pandemic. In addition to these changes in service, we've also seen a reduction in the number of meal periods and or the length of meal service times, which means that in many cases, students now have overall less access and less time in which to access school meals. Outside of these service changes, we're also seeing confusion among families regarding the return to a pricing program and the need to either complete that application or send in money, which means that we're seeing an increase in unpaid meal debt. Some communities are faring better than others in this regard and have managed to maintain close to pre-pandemic debt levels, though in many cases, pre-pandemic debt levels were already troubling. But other communities have reported upwards of $30,000 in unpaid meal debt, resulting just from the first full month of school during this school year. Programs are also facing increased administrative burdens this year related to the return to pre-pandemic operations, continued staffing challenges, and ongoing supply chain issues. One positive change that we've seen this year is an increased interest in the community eligibility provision and special provision 2, both of which allow schools to continue to offer meals at no charge to families if they meet certain program criteria. For the 22-23 school year, we saw an additional 5 LEAs elect to implement community eligibility provision and 3 LEAs implement provision 2. Unfortunately, at the same time that interest in these options has increased, we're simultaneously seeing a decrease in students that are eligible for free meals via the electronic direct certification process, which impacts an LEA's ability to participate in CEP, in addition to increasing the overall administrative burden related to the program. So kind of with those trends in mind, I did want to take, again, one moment to just talk about the general context of our programs and limitations. I have a lot of compelling things to say about this slide and the environment in which our programs operate, but in the interest of time, I just want to say this, that the local and federal laws and regulations governing the school meals programs are complex. So something that seems really simple from the outside looking in, like introducing a new menu item, actually requires a lot of careful planning and consideration. From understanding how particular food items fit within the meal pattern guidelines to considering the available cooking equipment, staff skill, ability to and process for procuring ingredients. There are just a lot of steps, and that's without even taking into consideration one of the most important elements, which is student acceptability. If you add on to this the financial considerations of producing full 5-component meals, including the cost of labor, food, and overhead for less than $4 each, and the fact that local level support for initiatives that will drive participation like breakfast in the classroom are often lacking, and food service professionals just have their work cut out for them. Unfortunately, in combination, these challenges often result in programs that struggle to meet the expectations of the children, youth, and families that they serve. And it also essentially serves to perpetuate the cycle of inadequate resources, because low participation results in lower funding, which inhibits the ability of schools to invest in the infrastructure, both in physical plant and in staffing, that would be required to make any meaningful program improvements. One positive impact of the pandemic has been an increased spotlight on the federally funded child nutrition programs, both locally and nationally, which has resulted in some new and or increased funding streams. So on this slide, you can see a summary of federal funding that's been infused into the program over the course of the last year and into the upcoming school year. These newer expanded funding streams serve to address some of the challenges that I mentioned previously, including equipment investment in the purchasing of fresh local foods, and funding to support districts in the face of rising food costs and other supply chain challenges. While these funding streams are both welcome and necessary, they are unfortunately all limited and are anticipated in most cases to end or reduce at the conclusion of the current school year, leaving program operators with a lot of uncertainty about what the financial future of their programs will look like. Where possible, we are taking the opportunity at the state level through the RIDE's Child Nutrition Program Office in partnership with other state agencies and community-based partners to invest new funding into efforts that will have a sustainable impact on our programs in the future. Key initiatives of the department are outlined in the slide and include expansion of the state's farm to school program and farm to early childcare efforts, to include increased local purchasing, as well as the integration of farm to school topics into various aspects of the student and or childcare experience through lesson planning, field trips, school gardens. We're also looking on a focus on improving meal quality, not only through farm to school efforts, but also through the development of menus that are culturally appropriate for the students being served. Increased use of and access to all of the federally funded child nutrition programs, including the child and adult care food programs, at-risk after-school meals program, and the summer food service program as a means to address food insecurity in the state. Food waste reduction and sustainability efforts, and last but not least, the expansion of the availability of healthy meals for all, either through state-supported universal free meals program or through the expanded use of existing programs such as CEP and Provision 2. Some of these efforts, as denoted with an asterisk on the slide, are impacted and supported through local legislation on these topics. Specifically, Rhode Island has recently enacted legislation related to food waste in schools and has also passed legislation which requires RIDE to propose in its budget a local funding formula for schools that is no longer tied to the school's meal program. The current funding formula, which is based on the number of students within a district that qualify for free reduced price meals, has long been a barrier to CEP participation, and a move away from this model could result in significant gains in the number of communities that offer school meals at no charge to families. So in closing, I just wanted to take a moment to highlight a few of the resources related to our programs and some of the other initiatives that I've discussed. I covered a lot of challenges during the presentation, but I hope that our partners on this call will take a step back and view those challenges as I do, opportunities to better serve the children and youth in our state. And the good news is that we're not starting from scratch. Though there's a lot to tackle, we've already done so much, and I would encourage anyone who's interested in learning more about the child nutrition programs, especially if you want to advocate for some of the initiatives that I've mentioned, to access the resources and websites highlighted on the screen. And I wanted to extend a special thanks to our partners in the Rhode Island Food Farm to School Network, including the Rhode Island Department of Environmental Management, the Rhode Island Department of Commerce, the Rhode Island Food Policy Council, Farm Fresh Rhode Island, and the Rhode Island Healthy Schools Coalition, all of whom have worked so hard and continue working hard to impact the way that the children and youth in our state engage with our local food system. And if anyone has any questions or comments, please feel free to reach out to me directly. My email address is on the screen. You can also feel free to put questions in the chat. And thank you guys so much. I look forward to continuing to work on this and report back to you guys.
Thanks, Jess. I think there might be a couple of questions in the chat. And as you and Andrew laid out, continued challenges, but also solutions that we can all brainstorm on shortly. We're going to hear from Meals on Wheels, from Megan Grady and Shayna D. Felice, who are up next. And I'll pass it over to you guys. Thanks.
Hi, everyone. Shayna D. Felice, Programs and Mission Impact Director here at Meals on Wheels of Rhode Island. So here you have some statistics that are based on Meals on Wheels of America, their fact sheet. So the total population of older adults in Rhode Island is approximately 260,000. Of that number, about 12.4% are experiencing hunger or food insecurity, so around 32,000. And we served in 2021 357,000 meals to 3,029 seniors in Rhode Island. And here you see a picture of this past July when we delivered our 20 millionth meal. Governor Dan McKee delivered our 20 millionth meal in July. And just this week, we launched our medically tailored meals program. Medically tailored meals are delivered to individuals living with chronic health conditions such as heart disease or renal disease, diabetes, and so it's conditions that are impacted by nutrition. And we receive these referrals from a medical professional or healthcare plan to help them improve their health outcomes. The meals are prepared by our third-party caterer, Trio Community Meals, and the menu is approved by a registered dietitian to make sure that it reflects evidence-based nutrition guidelines. Nutrition education also is offered in conjunction with the meals to promote healthy eating and overall better well-being. And this aligns perfectly with our new strategic plan. And Meg is going to talk about that.
Thanks, Shayna. Yeah, hello to all of our friends on the Food Policy Council. Some of you might be aware that in June, we announced the framework of our 2025 strategic plan, and we look forward to our board adopting the plan in their November board meeting. So Shane, Randy, I see your question. Happy to touch on that in a minute. Our strategic plan has 6 goals. There are 2 primary goals held up by 4 capacity building goals. And to speak to the primary goals, the first is to innovate and scale our more than a meal model. Even in the last couple months, we've had the opportunity to test different aspects of our model, one being a home delivered meal program for pregnant and postpartum women through a partnership with Women and Infants Hospital and Point 32 Health. And the second being a mobile food pantry that we are delivering to 90 individuals in the Providence area. So we look forward to sort of continuing to understand the opportunity that lies in our more than a meal model, which is nutrition, a life-saving safety check, and an opportunity for socialization to further advance health equity in the Ocean State. Our second primary goal looks at our home delivered meal program. We have really the perfect storm. The rising cost of food, the rising cost of gas, the labor shortage. Those are basically the 3 main inputs of our more than a meal model, on top of the increased demands of an aging population. So our second goal focuses on sustaining and growing our home delivered meal program. So let me touch right now, Randy, on how the medically tailored meals program is being funded. Meals on Wheels is a benefit for dual eligible older adults that have a long-term supports and services designation. So we are piloting our medically tailored meal program to that population. Individuals that were receiving Meals on Wheels, that our meals are being paid for by their health plan. We looked at our case management notes to understand who was also managing cardiac disease and reached out to them and offered a meal that could help them manage their chronic illness. So sustaining our home delivered meal program, trying new things, and then looking at our model, which is primarily volunteer-based, the infrastructure that helps us do this work, the relationships we rely on to deliver on our mission, and of course, continuing to support and evolve our board of directors. So the plan will be made available later this year, definitely before the end of the year. So we look forward to meeting with each of you to talk about how we can achieve this bold vision for 2025 together. And I'm happy to answer any additional questions that anyone might have about our strategic direction.
Thanks, Shayna and Megan. So hopefully you'll be able to stay for the breakout sessions so that we have a chance to brainstorm with you more in small groups. Again, looking at solutions and what the task force can work on in 2023. Last, but certainly not least, is Bethany Caputo from DHS to provide a SNAP update. Bethany?
Thank you, Randy. Good afternoon. As Randy said, I'm Bethany. Oh, I forgot to put my camera on. Sorry about that. I'm Bethany Caputo, the SNAP administrator at DHS, and I'm going to give you an overview of some SNAP trends and talk about some exciting upcoming initiatives. This slide shows the weekly SNAP application volume from January 2022 through October 2022. The weekly average volume has been around 1,116 applications submitted per week. As you can see, the volume has trended down in the beginning of the year especially, but is remaining fairly stable since then. We saw a spike in volume in early February, which can likely be attributed to resuming recertification requirements in January and households closing and then reapplying. I anticipate the application volume will remain fairly stable in the coming months, although different factors may impact that, such as the impact of certain COVID-related waivers ending or increase in outreach support in the community and enhanced access points. Next slide. This slide shows the SNAP participation rate by households for the period of October 2021 through June 2022, which is our latest official data, but I do have some more updated numbers on a later slide. Participation rates have remained fairly steady in the past year, with a dip from January through March, again, likely due to resuming interim reporting and recertification requirements, which inevitably leads to additional closures. We are seeing a slight rise in participation in recent months. I also included the Rhode Island unemployment rate on this chart as well, because we typically do see participation rates align with unemployment rates. However, as I previously mentioned, there are multiple factors that can contribute, sorry about that, such as certain COVID-related waivers and outreach support. When the federal public health emergency ends, the expansion to student eligibility ends. We've had additional flexibility around allowing more college students to be eligible for SNAP without having to meet the work requirement. So that may cause a slight decrease in participation. We also have a waiver in place that waives the time limit for able-bodied adults without dependents through May 31st of 2022, which when ended eventually may impact participation due to time limit closures. But we also do have an exciting new SNAP outreach initiative through our partner and Relief, who I can see is on this call. That's introducing a text-based screening tool where customers can text a number on their phone and see if they're potentially eligible for SNAP. And then if they want to apply, they can receive assistance over the phone. So we're excited about that upcoming work. Next slide. This slide provides some information about the makeup of the overall SNAP population. I'm not going to go through everything in the interest of time, but it's a point in time snapshot of data pulled on October 1st of this year. So this information is really changing. But you can see we have a large population of individuals who are age 60 and older, as well as those who have disabling conditions. We see a bit of a gap or opportunity where there are many households that may be entitled to deduct their medical expenses and potentially receive more SNAP benefits, but they are not currently receiving the deduction. So we are working to spread the word about the medical expense deductions to our outreach partners. And we've also created a flag in our eligibility system for eligibility workers to make sure to ask about these expenses during the interview. So we're hoping to close that gap. The average benefit for a SNAP household is on here is listed as $280, but this doesn't include the extra benefits that households have been receiving since COVID began, which Andrew mentioned will eventually sunset when the federal public health emergency ends. We have about 2,423 college students participating. And as I talked to Carolyn, she gives us one workshop and the second one. I'm sure if that was a question. As I mentioned before, this population may be impacted by the end of the COVID-related college student flexibility. Next slide. And we'll talk about those exciting initiatives that I mentioned. In the fiscal year 23 state budget, DHS is to implement a SNAP incentive program, which we have named the Eat Well, Be Well Rewards Program, where SNAP participants can receive 50 cents for every dollar spent on fresh fruits and vegetables at participating retailers. Right now, we have programmed a monthly cap of $25, but this may change as the program progresses. The incentive that participants receive can be used on any SNAP eligible food item and doesn't have to be spent on fresh fruits and vegetables. We've completed the design work for this project and development is expected to begin soon. Rhode Island Public Health Institute is helping us engage and recruit retailers for the project. But due to some technology requirements, We're finding that many retailers aren't able to participate until around March. We're also seeking some clarification from the governor's office about the length of the program, but more to come on that. And finally, we received federal approval to implement an elderly and disabled simplified application project, also known as ESAP. The program is tentatively scheduled to launch on December 1st. We're still kind of working out the technology pieces to that. This program allows households comprised solely of elderly, age 60 and older, and disabled individuals with no income to have a lengthened certification period of 36 months with no interview requirement at recertification unless certain other conditions apply. It also simplifies the verification process by allowing DHS to verify as much information as possible through the external data sources we have available to us rather than requesting verification from the household. A short and paper application has been created for this population so that they only will have to answer questions that pertain to their household. And then eventually we'll be implementing a phase 2 of the program sometime next year that will shorten the online application as well. And active households will automatically convert to ESAP if they meet the criteria, and we'll be sending along a stuffer with some information about what that means in their benefit decision notice. That's all I have.
Thank you so much, Bethany.
Thank you.
And thank you to Megan and Shayna and Jessica and Andrew. I think put all together, what you've presented today really gives a very useful and comprehensive look back and look forward at where the state is in terms of hunger at the moment. And it's really the perfect launching off point for talking about the most important issues that we want to address as the Hunger Elimination Task Force in the coming year, which is going to be the focus of our breakout sessions, which we really hope that you will participate in, because that information you share during those breakout sessions is compiled and it is what we use to plan, to develop the plan for 2023. So as Randy noted earlier, for 2022, the stated goals for the task force were to broaden the network, to deepen the collaborative environment for problem solving, to reduce food insecurity by providing information that helps all the organizations that participate connect people who are experiencing food insecurity with supplemental food delivery services, and to educate decision makers about the policy, investment, and regulatory solutions that can be implemented to increase the resilience of both our emergency and our supplemental food systems. So some of the accomplishments this year have been that we've launched the monthly Rhode Island Food Access Bulletin so that task force members can stay informed about each other's activities and relevant opportunities and what our state agencies are doing. We published a list of Rhode Island food supplemental and emergency delivery providers, which you all should know about and have access to now. We grew the listserv by 37%. I think you guys put a lovely chart together with a side-by-side if you want to go to that one. So we welcomed new members, especially from healthcare fields, small food businesses, local community-based organizations, and overall grew attendance from 134 individuals to 152 individuals, 2021 to 2022. We also piloted several communities of practice that a number of you have been participating in that continue to work in between quarterly meetings. And these communities of practice have become important tools for networking between organizations, problem solving, and sharing important information and resources. So the task force remains a forum for checking in on that foremost goal of reducing food insecurity in our state and understanding our food insecurity infrastructure. We want to go into the breakout rooms asking you a couple of really fundamental questions about the task force. We want to know how it's benefited you and your work in 2022 and how it can continue to do so in 2023. We also want to ask you specifically what topics the task force should focus on next year. We had a focus on innovations in healthcare this year. We had a focus on serving older Rhode Islanders. What topics should the task force focus on in 2023? And I think that Allison is going to break us into breakout rooms where you will have a facilitator who will be taking notes to hear what everybody thinks. After that, we will come back for a quick report out before we close.
Okay, just bear with me. I'm going to open the rooms now. And if anyone wants to change rooms or has an issue with getting into their room, just stand by.
Welcome back, everyone. Thank you so much for sticking with us. We had a great breakout session, and I bet you did too. We are going to spend a little bit of time now going over some of the main findings and maybe aha moments from those breakout sessions. And so I am going to call on our breakout room facilitators to do a brief summary, maybe just one or 2 minutes on the main takeaways from your breakout session. And I am going to go in order. I have people's names. So I wonder if Randy, you wouldn't mind going first.
Sure, thanks, Nessa. So first question, how has the task force benefited your organization and supported your work in 22? Themes that were called out were the networking with other organizations, so the continued hearing of best practices from others, particularly in the innovative areas that are happening with some of the programs throughout the state. The data, people want to see continued recaps of data. And for those who are using the data, like for example, health equity zones, it really helps them with their asset mapping as well. Sharing of funding sources was also recognized as a benefit of the task force. And we talked about the importance of coordinating the funding streams so we can leverage and align in the best way possible. Regular meeting cadence has helped to keep us on track. Like we know this meeting comes up quarterly, so it's keeping the momentum flowing. With regards to topics for 2023, universal school meals, not just at the federal level, but continuing to advocate at the state level, continuing to share network, share updates, hear best practices, share the data. So let's not lose sight of that as like part of these quarterly meetings. What we also talked about with regards to the White House conference was the media attention that conference got, and how do we take advantage of this moment in time, ride this wave, and continue to build on that. And I thought back to when National Food Day was spearheaded by CSPI back in 2010, 2011. We totally took advantage of that moment in time by creating a Rhode Island Food Day. So how do we do that strategically here in Rhode Island, especially as we enter the next legislative session? And then programmatically, status updates on programs that are just getting going, like the LFPA and the new shift of Senior Farmers Market nutrition program, how that shifted. So continuing to get a report outs on those types of programs as well. Thanks.
Thank you so much, Randy. And I am going to ask Swanette to go next, if that's all right.
Hi, everyone. Happy to be here. We had some great conversation in our breakout room. So for the first question, in what ways has HETF benefited your organization? There were a lot of great points there. Being able to learn of all the different programs being piloted and the program incentives have been really helpful to share. Things like farm fresh information with the residents, especially those who've been struggling with transportation, order and delivery. So giving them this information can be great for them to navigate their access concerns. It's been really helpful to find out what's happening in the community and how people are connecting to food access and addressing how we are addressing food insecurity. And right now, I'm going to use someone's word because they said it really nicely. But in the moment of transitions, innovation, and change, we're coming out of a crisis right now. It's really humbling to be able to touch in with the data that's being shared and to see what is the big picture and also see the frontline practice that's happening. Resources like the guide to delivery are really valuable and shared. We are able to share this information within our own networks. And let's see, using these opportunities in the meetings to really see what food delivery should look like, talk about these models, talk about best practices, farm to table, and important information to share. For food access topics and issues for next year, some great things that were suggested were how is food access related to health equity? How can entities like AEs coordinate with DHS or other places to streamline processes to access benefits and et cetera? How can we support the frontline public care workers to help our residents? Things like SNAP training for CHWs or frontline workers, how to use the CHWs or certain workforces to help with these applications and just, a lot of the red tape that comes along with some applications. And things like providing, maybe promoting more like technical assistance that may be available to meet with teams, like health teams, to see how they can support food access and address food insecurities for their patients and residents. And yeah, things like that. So that was shared on my team for the most part.
Thank you so much, Swanette. That was wonderful. Let's see. I'll ask Diane to go next. Diane, I'm going to challenge you with a 90-second limit if you can do it.
I can do that. So everyone said that they valued the learning opportunities that they had at HEFT. Some people also talked about networking, collaboration, human connection. So those were some of the benefits. Looking forward, everyone wants to continue to use HEFT as a way of staying up to date on what's going on. There were a number of suggestions about things that could be added to sort of the update list, including the LFPA program, the Rhode Island Foundation grants that we heard about today, how that SNAP incentive program is rolling out, what's going on at the General Assembly, especially if it's in the spring, and we can talk a little bit about policy and legislation that we might be interested in. M-Relief, food prep as an area that might be growing, and delivery. Delivery is still an issue for a lot of supplemental and emergency food providers, and we don't want to drop that. I bet I just did 90 seconds or less.
I didn't time you, but I think that was probably perfect. Thank you, Diane.
You're welcome.
I am going to ask Julie to go next if she's still with us.
I'm here, yes. So just really quickly, for the first question, the looking back, it was really helpful to have deliverables. Our group said the dashboard was really helpful, being able to say, this is something we're going to do and was delivered on it. It's really helpful to attend to make sure we're not duplicating efforts and learning about new things that are happening, and helps to understand what's going on, what are the blockers, and especially for folks that are maybe new to this space, it helps to just kind of jump in and understand who are the partners. There was some feedback on the format. Virtual can be really helpful because it allows for it to be more inclusive. People don't have to drive somewhere. But it was noted that it is really passive, and also that there's a lot of different meetings related to food access and food security. And so maybe just some clarity and consideration around how are things different and when should folks participate and how can we make these meetings even more interactive. And we ran out of time for everything else.
Thank you so much, Julie. Josh, do you want to really briefly report out?
Sure. So folks said that this group has been helpful to get a bigger picture, to make increased connections with organizations and individuals that wouldn't usually connect with, a great repository for sharing information, and it's informed the work of some of the organizations and supported the strategic planning. Topics and issues going forward, and also sort of opportunities for improvement that were talked about. Sort of a need to translate all of the information into kind of practical, actionable steps and resources. People get overwhelmed by the amount of information. We look for more time and space for questions and interaction to increase engagement. Also had echoed, I think, what Julie shared, clarity between the this and other hunger elimination, food access work, that the Food Policy Council is doing and that this group is doing.
Thank you so much, Josh. I want to just thank everybody for participating in the breakout sessions. I want to note in our breakout section, multiple people apologized for their answers maybe seeming self-centered, but everybody's purposes for being here are very selfless. And I just, wanted to make the point that everyone's individual mission and goals and objectives, you are the task force, and your collective hopes and wishes and desires for topics and issues that we would cover in 2023 are what sets the stage. So appreciate everybody sharing. I think that I will note a couple that maybe didn't come up in earlier breakout summaries. Definitely a focus on medically tailored and home delivered was a big thing. Also being kept aware of changes coming as a result of pandemic extension programs running out, especially those that are running out in January. And understanding some more about, maybe making it more accessible to understand what is available at food pantries, at particular food pantries on a more up-to-date basis. Maybe looking into some of the work going on with DoorDash and Instacart in terms of delivery being something that we'd want to know more about. So the group of facilitators will be getting together to do more of a comprehensive breakout. You know that Caitlin will be putting that together in a wonderful set of notes with takeaways and next steps that we'll be sharing back with you. The notes from these meetings do take a little bit longer than regular meeting notes because we do try to aggregate that and make it into something streamlined. And then we'll also be working together with the state to put that plan together with your feedback for 2023. So thank you all so much for joining us today. We would love to close out with a final question that Allison just put on the chat with some special stars. I don't know how you did that, Allison, but if everybody would please share what is your biggest motivator in continuing to do this work? Just a 1-word or 2-word answer would be great. We will capture that information in the chat and share it back with you. And give you a minute to do that. We don't have meetings set yet for 2023. We'll be working with our state partners to get the 4 quarterly meetings set and to share those out with you very soon. And this concludes our Q4 Hunger Elimination Task Force meeting. Thank you so much.